live on Facebook. And
No swearing. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here today with Lisa. What's up, Lisa?
Not much.
We're going to talk today. Lisa has done weight loss program with us.
Yes.
And you also, I didn't, we just kind of met. You also you had a neck injury you treated with us.
Yes.
And you're doing the tan injections.
Yes.
That do other things too. We'll talk about that. But so we're going to cut the break and we'll be right back.
put that in there, and here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is a website. Check it out. I'm here with Lisa. What's on, Lisa?
Great.
So we're going to talk today a little bit about, we'll start off, Lisa, you did a weight loss program with us.
Yes.
So we're on the radio. So tell us, how old are you? Tell us everything about Lisa.
I'm 50 years old. I'm a medical assistant with advanced cardiovascular for 11 years.
Same place for 11 years? That's long.
Yes.
Long time, yeah.
Yes, I
That's
love
awesome.
it. 2 kids, a dog, a husband.
How old are children?
18 and 20.
Okay, so they're kind of on the way out? Or?
Yeah, I got one out, one on the way.
Okay, very cool. You're on the back nine, right?
Yes, absolutely.
And then, so you, how much weight did you lose?
Almost 50 pounds right now.
Really?
Yes.
Wow, okay.
I'm
Yeah,
still
because you're
going.
not, because you're thin now, like, so I didn't know, you know.
No, I wasn't.
So what did you weigh when you were at your heaviest?
228 when I started with you guys.
Well, and now, is that something that you had put on over time? Were you always heavy? You know, like, what's your
I had
story?
off and on periods and did different things to try to lose weight. And then I had, in November 2017, I had my last neck surgery. So hadn't been able to work out, do a lot of stuff I was doing before that. And bam, woke up and there it was.
So you were thin at one point.
Probably after I had my kids,
Okay.
and then got put on medication and stuff. And the weight just kept coming on.
How'd you hurt your neck?
They said I have degenerative disc disease. So
Okay.
I've never really had any per se injuries.
No injuries, no traumas, anything like
Nope.
that. But so
Bam, they just rupture.
And you said how many surgeries have you had?
I've had 4 neck surgeries, 1 lower back surgery, and 3 knee surgeries.
Wow, that's a lot of.
And a foot surgery. And
So those surgeries obviously, so that really hindered your ability to exercise, work out.
absolutely.
So then you start putting weight over time. Like, what were you before this whole process started? Would you say?
Probably 150.
And then slowly over time,
And just kept gaining and gaining, and did different things, got down, but never stuck to anything.
And what was we have a lot of patients on here that do weight loss. Was there they usually have something that happened? Like there's one day that like that's it, I'm doing this. Did you have a moment? Did something happen?
Oh yeah, I looked in the mirror and I said, "Oh good God!" And none of my clothes were fitting me. Everything, and I hate to go shopping for clothes anyway. So it's like, oh my God, nothing's fitting. I'd bought new uniforms. They're so tight on me, and just didn't like what I saw anymore. It was, annoying, frustrating. Like I even thought about like, oh, let's go do gastric bypass. And then I saw your guys' ad on Facebook, and I said, let me give this a call. I called that day, and they're like, oh, yeah, we have some cancellations today. Got me in that day. I was like, oh, this might be a good sign.
Yeah.
And decided, I went in with no expectations, to be honest with you.
So you literally saw a Facebook ad. Didn't know anyone that did the program or anything like that.
Nope.
Just kind of, wow.
Didn't know anybody.
That's kind of a leap of faith.
Yeah, and I just, well, yeah, it was. I kind of just said, well, like I said, I went in with no expectations. I thought it's either going to do something or it's not going to do something. And, oh, it did something.
That's awesome. So when did you start the diet?
I started in the end of August.
Okay.
First week in September, I think it was.
And then, so I guess for the viewers, first of all, when you come in, like, was there any pressure or anything?
Oh heavens no! Like I mean, I made the decision that day to, after I watched the little 2-second video and talked to Dave, and I just said, okay, let's go for it. And so I did it. And like I said, had no expectations. It's either going to work or it's not going to work. And yeah, I was really surprised. And they got me set in. He's like, you sure you don't want to think about it? I said, no, let's just, But no, they didn't pressure me. Even during the program, there's no pressure to do anything.
All right. So then you started the program, and how much weight did you lose? Like how fast did you lose weight?
Oh my gosh, it was amazing. Like the first week was like 10 pounds immediately. I was like, oh geez, what is going on here? Yeah, no, and it's super easy. I mean, it's almost it's like you can't fail on the program. If you fail on the program, you're doing something wrong. I mean, I stuck to it. They give you the diet and everything before you even order your stuff. So you have that to prepare and be ready for what's coming. And it was so simple. It's more, I mean, I don't even really call it a diet. It's more of a lifestyle change. You're eating normal food. You're not buying any food. You're, nothing like that. No prepackaged stuff. So.
And that is a key component. That one of the things we like about the diet the most is if there's a diet you're doing where you're buying shakes or prepackaged meals, you don't learn how to eat. And at the end of the day, you have to learn how to eat properly.
Right.
You have to learn how to eat properly if you want to sustain it. Because if you do, prepackaged meals or whatever, that might work when you're on the diet, but unless you plan on doing that for the rest of your life, which is not sustainable, sooner or later you're gonna have to go back to inexpensive. You're gonna have to go back to going to the grocery store, buying food, cooking your own food, and portioning your own food out. If you don't have that skill set, you're gonna put the weight back on, unfortunately. And that's why the majority of diets don't work out. The majority of people that go on diets, end up within the next 2 years putting on 10 or more pounds.
Oh yeah.
And it's just because they don't teach you healthy eating habits.
Exactly. And I'm still I'm done with the program now, but I'm still continually every week.
Because you're never really done with the program. Because once you learn how to eat, then you just
you just keep doing it.
So it's really not even a diet. I like what you said. It's good. It's a lifestyle reset. Maybe
right.
It teaches you this is how I'm supposed to do it.
Mm-hmm. And what to eat, and
And it's healthy. I mean, and you go to the grocery store, you're buying foods, but
real people food.
Yeah, but nutrient dense food that fills you up,
right.
that's good for you and makes you feel better and all that different stuff. And there's several key components of the diet, but probably my favorite is the fact that you get a food scale and you learn how to portion food and eat food properly.
Oh yeah.
That's so important for anybody. A couple other components of the diet is we also use appetite suppressants. And did you use ephedrine or Garcinia?
Yes, ephedrine.
Okay. And then ephedrine has been safely used since the 70s. And that really helps to, when you first start the diet, you're calorie restricted, obviously. Mm-hmm. So the appetite suppressant does help you not feel hungry.
Right.
And if anything, the complaint I get from people is sometimes it's hard to eat all the food you're supposed to eat on the diet because you're...
Yes.
Did you have the same issue?
I did have some issues in the beginning where, there was 1 week I didn't, I lost, but I felt that I should have lost more. And here it was because I wasn't hitting my calorie goal that I should have been hitting. And she's like, well, your body's going to go into starvation mode because you're not eating enough.
Right. That's the downside to the appetite suppressant. And I hear that from people.
You just throw in a few extra healthy snacks here and there and you get it up. But it was just totally easy. Way too easy.
That's awesome. And then, the thing we use, so we use appetite suppressants. We also use HCG.
Yes.
And HCG is human chorionic gonadotropin, which is a naturally occurring hormone in males and females. But most people have heard of HCG in females in particular because when a female's pregnant, they produce a lot of it. And the reason a female produces a lot of HCG when they're pregnant is the key component is feeding the baby, and you feed your baby with your deep fat stores. So when a female's levels of HCG are elevated or males are elevated, it forces the body to burn your fat. So it's kind of tricking your body,
yes.
So and it's a trick we use when we calorie deplete to really burn your deep fat stores. And what's cool about that too is not only do you lose weight, but usually you lose weight in the areas that come off last first. Right. So if you're like a butt person, your butt comes off first. If you're a love handle person, it seems like those fall off. Did you notice your shape changing?
Oh yeah.
Yeah,
and thighs and the belly.
Yeah, because everyone has these different areas they store. So the cool thing with HCG. Is those areas that come off last will tend to come off first, which is cool because you want your shape is just as important, if not as important as the actual weight. We also do injections of L-carnitine and B vitamins. You come in once a week and do those. Once again, these are natural occurring substances, but they're from a pharmacy, so they're prescription strength to assure that your body is going to be in fat burning mode.
Right.
You know what I'm saying, and that's very, very important. And you also have a weight loss coach. Who is your coach?
Ariani. The best.
Yeah, she is the best.
She's amazing.
I actually met her. A funny story with Ariani is my son races go-karts. So when he very first started racing go-karts, we would go to this place called Buckeye Raceway here in Columbus. Mm-hmm. And the first time we ever went in there, there's this little girl. At the time, she's like 18.
Oh, she just told me that story yesterday.
She's 18, and I went in there, and from the first time, I just introduced. I'm friendly. Introduced myself and Blake, and then every time I saw her after that, you come in she knew every person's name. She ran that place. So after we'd go there once or twice a week. I was like, this girl has to work with me. I don't know what we're gonna do with her, but I'm gonna get her. Mm-hmm. And so, and fast forward, this is probably 3-4 years later. She's part of our team.
Oh yeah.
But she's amazing. But she's done the weight loss program herself.
Yes.
And that's a key thing. And no matter what coach you get, they've been through the weight loss program, because you can't have like a skinny person that's never dieted tell you weight loss, because that doesn't work out. But
they don't know the difficulties, the struggles that everybody has, and then she does the monthly meetings, which are really nice.
You guys all get together and talk,
and then you meet other people that are doing it and what things they're struggling with, and and especially like certain like foods that they're eating that you may not have thought like, oh, I can really have that. And,
so that was her. That was her baby. That was her idea.
Yes.
Yeah, that was her. That was her little brainchild.
Yeah, it's been really nice. We had to cancel this week though because of the weather.
The cold weather. Yeah,
oh, she's going to get it back on though.
That's cool. But but everyone who does the program is assigned a coach, and that coach is someone who's been through the diet program, and they're there to assist you, because everyone, there are different struggles with weight loss, and when you're having a tough time, you can reach out to your coach. We also have these meetings where other people are on the diet get together and just hang out and talk. And kind of talk through, what challenges are, and really motivate each other.
Right.
And there is a level of accountability too.
Oh yeah.
Which is important. When you come for your weekly weigh-in, everybody loses weight on the diet. So if you don't lose weight, we know you've been cheating, right? So then,
even though they don't think they are, but they have. Yeah, there's
so we're there to support you and help you out, because at the end of the day, it's a failed program for us if you don't, hit your target weight loss.
Well, that's a shame, because they're not doing what they're supposed to be doing if they're not losing weight.
Right.
So it's just too easy.
So then basically you're assigned a coach, you're using the HCG, you're using the L-carnitine injections and the appetite suppressants, and obviously just learning how to eat properly are the key components. And,
right.
And we've had, several patients lose over 100 pounds. Your 50 pounds is amazing. I mean, and the other cool thing about the diet is when you're losing weight that fast, I think it helps because people notice it, right?
Yeah, people started noticing it. Like, I noticed it on the scale, but other people were noticing it before I was physically noticing it.
And that
Because
motivates
you look at yourself every day. Oh, yeah.
Someone say, hey, man, what's going on? What's going on?
Like,
what are you doing?
Are you sick? What are you doing? How are you losing weight? And I'm like, no, I'm losing it on purpose.
Yeah. But that's cool, because a lot of diet, in a typical diet, you lose 2 pounds a week. You don't even notice that.
No.
And a birthday comes up on the weekend, or something, and you eat, and you put the 2 pounds back on, and it's kind of like a quagmire. If that makes sense.
Well, especially like our patients, they come in like every 3 to 6 months to our office. So for them to come in 3 months and be like, oh gosh, what's going on with you? What are you doing?
That's awesome.
So it was kind of exciting.
That's awesome. So, and then you also mentioned, so you had these neck injuries, and you had multiple neck surgeries.
Oh yeah.
And I didn't realize, but you actually ended up treating at the Buckeye BPMR office also.
Yes.
So what's going on with your neck? So you've had these different surgeries. What happened? The neck's just
they say
degenerating?
Yes. So like the first one originally was in like 96, and one of my discs shattered, so it was like in the nerve. And like this last one that I had like the tingling and pain down my arm. Like I still have permanent nerve damage in my hand from it. So so it's been, and this last one has really taken a toll as far as recovery. They had to go through the back of my neck this time, so I guess due to more muscles and everything.
It's more complicated procedure.
Very painful.
Yeah.
And so I came over to see
now, do you have fusions, or what do you have?
Yes. There's titanium plates in there. There's like a cage. There's fusions, nuts, bolts, screws. I guess everything.
Bionic woman.
Yes. I keep telling my husband when I pass, I'm like, you better have me cremated and recover all that titanium.
Yeah, it's worth
recycle
something, right?
it.
Yeah, it's worth something.
Something.
So, but you kind of told me what happened in your case, and this does happen, is they kind of relegated you to pain management. They just said, hey, listen, you tell the story better than me probably. So what happened?
Basically, there was nothing else they could do for me for the pain, and so they referred me to pain management, which I didn't care for that, but they said I had to go. So I basically wasted 8 months waiting on some injections that never, got approved or never got asked for approval. And I came to see you guys, and within, 4 days, started getting the injections, and it's been a miracle.
That's awesome.
Yeah, like I feel a lot better.
And the key thing is we don't use opioids.
No.
At our facility.
Well, that's the thing. I didn't want. They weren't working. I didn't want them, and they kept making me go.
Yeah,
so I said, no, I'm not doing it.
Unfortunately, it's like a dead end street too. A couple problems with opioids. Number one, opioids really weren't designed to treat long term pain. They were designed, you have neck surgery right after to get through the pain surgery, open heart surgery, like something major. But opioids were never designed to be taken for the rest of your life because they're so addictive. But there's lots of physicians out there, unfortunately. You heard the moniker pill mill. That you'll go there, and the same people come back every 2 weeks to get their Percocet or Oxycontins, and they never get better. And the other thing that we've talked about on past shows is when you're taking opioids, it destroys your endocrine system. So testosterone, estrogen, it destroys all that. So then you're more likely to have depression. Your body's going to break down more. It's literally a dead end street.
Right.
And I even see clinically in our office people that are on long-term opioid therapy. They just don't get better. It's sad. I mean,
right.
You can tell their skin's like that pasty color. Like it's terrible. And it's a huge problem. Last year in the United States, like over 80,000 people died from opioid overdose. It's a huge. That's what almost like 900 people a week. So it's a huge, huge, huge epidemic, and it's because physicians, instead of looking for alternative ways to help people get better or trying different stuff out, just say, hey, go here or go there, and anyone can get hooked on pain pills. Anyone can.
Yeah.
And it's not that the people are bad people or they want to get addicted. It's the chemical is addictive. And we've had people that I've known personally that said the first time they did it, they were hooked. They knew it the first time. That's crazy, right?
Oh yeah, scary.
And I also harp all the time too. There's a huge epidemic of kids doing this stuff now. And where the kids are getting it is mom and dad or grandma and grandpa have it, and they're taking it for their chronic back pain, and the kids steal the pills. Mm-hmm. And then the next thing you know, they can't get the pills anymore, so then they switch to heroin. Like it's such a slippery slope, and that, that's why Buckeye we don't do any opioids. We do. I think in your situation, we probably use some lidocaine, or I'm not sure what, but all non-addictive things just to get the inflammation out of there. We also do stem cell injections, ozone injections. There's lots of different ways to handle pain without using opioids, and to get the body to fix itself. So I'm glad that worked out for you.
Oh, it sure did.
And luckily you maybe the weight loss could have saved you from being hooked on thinking in the bigger picture, than the pain pill thing.
Oh, absolutely.
And the final thing I want to talk about is we also talked about a little bit. You're doing the new Barbie drug we got. You didn't know it was called Barbie drug, right? No. So at Buckeye, myself and Dr. Bainan, we're both went through a peptide certification through George Washington University. And just to clarify, so what peptides are peptides are simply chains of amino acids. So they're naturally occurring. Your body has over 3,000 peptides in it. But peptide therapies, and this is something that we're certified in at Buckeye. These peptides signal your body to do different things. So we use peptides to increase growth hormone. But another one we use is we have a peptide called melanotan-2 that actually helps you become tan. Pretty cool, right?
Yes.
And I know you just started, so, but obviously the advantage of this is some people like to have some color, but unfortunately what they'll do, and I was guilty of this too, and I've had skin cancer, is I used to go to a tanning bed, back when I was in college, right? Yeah. And then in the summertime, I'd lay at the beach and cook my skin all the time, and that's probably how I ended up with basal cell cancer. And if you're in the sun and you're tanning, it's not if, it's when you're going to end up with skin cancer.
Right.
It's a foregone conclusion. You don't have to tan or go cook at the beach to have some color. And basically, this melanotan peptide was developed to help prevent skin cancer. And basically, it's a chain of amino acids that signals your basically your melanocytes or your tan cells in your skin to become darker. So it's a way of not going in the sun to develop a nice, natural, glowing tan. Now, there are a couple side effects, though, which you didn't even know about, so now you're going to be paying attention. They call it the Barbie drug because melanotan also has proven to help you lose weight, which is cool, and it increases libido.
Okay.
So... tell your husband to watch out. But these, but that's why they call it the Barbie drug, because the melanotan will help you get tan, but it also increases libido and helps you lose body weight. So who doesn't want those, right? Yeah. So, yeah, and the way it works is pretty simple. It's use a little insulin needle, and you just do it yourself at home, right?
Yep.
Yeah. And basically, you do the injection every day until you get the color you want, and then once you're at that color, you just do one injection a week. It doesn't injection hurt.
No.
Yeah, it's whatever. So
it's itty bitty.
Yeah, the only time we don't recommend it is if you have a lot of freckles. It will make your freckles get worse. So if someone comes in and they have a lot of freckles, we don't recommend using the melanotan. But if you don't have freckles or age spots and you want to be tan without going in the sun, it's a safe, effective way to do this.
Yes,
so it's pretty. So we'll see how your tan looks in a little bit.
I want to be Malibu Barbie.
All right. When did you start? How many days ago?
It'll be 2 weeks on Sunday.
Oh, you'll any day then. It's weird. Like what happened when I did it is nothing happened, and all of a sudden I look at the mirror and I was like, oh man, I got a nice.
Well, it's hard. I can see a little bit of difference, but it's like hard to tell because when you go to a tanning bed, you usually have like something on, so you can see your tan lines. Well,
You're not going to have any tan lines.
Everything's
Yeah, you're not
color,
going to have tan.
so.
Yeah, you're not going to have tan lines. But you'll just see all of a sudden you look in the mirror, and then all of a sudden you're like, where'd you go on vacation? Where'd you come back from? Which is kind of cool, right?
Oh yeah.
So it's like, anyway.
So I can just make up someplace.
Yeah, make up whatever. Yeah, have fun with it. Have fun with it. The other peptides we use at the office is the melanotan, as I said, is used primarily for tanning purposes. We have another peptide that we use called PT141. You're not using these, by the way, but we're just talking about. So, but what PT141 does is it really increases libido. And there's a lot of, in particular, females out there, especially once they hit that menopause and that area, they just have real low libido, which can become an issue in relationships. And the PT141 is a peptide. The same thing as an insulin syringe injection that you do twice a week. The clinical studies have shown is very, very effective.
So is that one that they do themselves at home, or they come into the office?
They do it themselves. All the peptides, because it's just an insulin needle, it's like a little quarter-inch needle.
Right.
The patient just does it themselves. No sense in draining it into the office.
Yeah.
And with the PT141, then it allows you. Most of the females say they'll do it before the weekend or something, right? And then do it one other time during the week because it lasts. The half-life of it is about 3 to 3.5 days, so it kind of increases it the whole time. But I can tell you, we have quite a few females doing it now, and their husbands are very happy. so that's
right.
That's a good one. We also have another peptide called BPC157, and BPC157 it helps the body heal better. It is real simple. So, and the way that it works is it basically, once again, it's a peptide. It helps stimulate stem cell production in the body, and very, very effective. A lot of NFL athletes are using it at this point. It supercharges your healing. So we use it at Buckeye too because obviously we deal with a lot of pain patients, and if it's particularly like joint degeneration, like you're talking about your neck, BPC 157 would be if your neck flares up against something you would consider doing because it works amazing.
Oh yeah.
And we also use it quite a bit when people are going to have surgery. Pre and post surgery because it helps the recovery of that big time. So, and as I said, these peptides have been around for years, more so in Europe than the United States as a technology that's come here, but it's been around forever. And then the final ones I want to talk about is the growth hormone boosters. And pretty much everyone past age 30, 35, your growth hormone levels decrease. And why growth hormone is important is, number one, growth hormone, there's direct correlation to heart disease and growth hormone deficiency. But it's also for all connective tissue. Your heart's a connective tissue, your blood vessels, your hair, your skin. And people spend all this money on, face creams and all this different stuff. But if you really want to keep your skin young, it comes from the inside out, and with growth hormone. And the peptide we use for that is Simorlin. And basically, what Simorlin does is it stimulates your pituitary to produce more growth hormone, which is safer than taking growth hormone. You can buy synthetic growth hormone, but the problem with taking synthetic growth hormone is, number one, if you take growth hormone, your body quits producing it. So then if you couldn't take it anymore, you would be stuck with nothing, where the Simorlin stimulates your body to produce more, but it already did.
Oh, okay.
You know what I'm saying? So there's no negative feedback
Right.
on it. But the other thing that happens is not only do you produce less growth hormone, but your body, as you get older also produces this thing called somatostatin. And what somatostatin does is it binds to your growth hormone and makes it unusable. So we use another peptide called ipamorelin, and ipamorelin attaches to somatostatin, or they call it a somatostatin antagonist. So the growth hormone you have is actually used by the tissues in the body. So the combination of the Simorlin with ipamorelin, dramatic changes. And we probably have 200 or 300 patients on it at this point. I've never had one person say that they didn't love it. I mean, customer satisfaction is through the roof. And the big notices, the changes that people notice is, number one, if they have old nagging injuries, in particular like connective tissue injuries, they get better. Skin and hair improve greatly. And another telltale sign of growth hormone deficiency as you get older is you'll see older people, they can have lean arms and lean legs, but you'll start to develop abdominal fat. And that's growth hormone deficiency. So the growth hormone booster really boosts the amount of fat, or gets rid of the fat, in particular around the abdominal area. And we have several, patients, guys and girls that are in their 50s and early 60s, they're in their lifetime best shape. Right. Simply by using the bioidentical hormones in the growth hormone booster. So I'm going to kind of wrap up here. You know, basically we came on here weight loss and we got off on a bunch of other stuff. You know, I know a lot of people listen to the show and they, they think about it, but they don't take that step. I mean, what would you tell them if they're overweight, not feeling good?
Go for it. At least go in and hear, watch the video. It's very short. There's no pressure to do anything. You can walk out the door with nothing, or you can take a leap of faith like I did.
And lose 50 pounds or
Yes.
more.
Yes. Like I said, I had no expectations and was amazed.
Yeah. Well, you're an inspiration. Thank you for sharing your story, because it's weight loss is a huge deal.
Yes.
And a lot of people suffer with it, and I think a lot of people are just, they've failed so many times at diet, they just think
Yes.
that, they'll label themselves, I'm big boned, I can't lose weight. Anybody can lose weight.
Mm-hmm.
You got to be disciplined like you, and you got to follow a program. If you follow a program, it works every time.
Oh, yeah. If you fail on this program, it's your fault.
Well, thanks so much for coming on, Lisa. It was
Thanks.
fun. Until next time, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. Check out the website, buckeyepmr.com. Thanks.